U.S. cuts global AIDS funding. Is the world facing a new HIV crisis? In a shocking move, the United States has announced major cuts to its global AIDS funding. Welcome to TVAI. Today, the world is holding its breath as the United States officially announces a drastic cut to its international AIDS funding, a move that is sending shockwaves across nations and health organizations. For decades, the U.S. has been a cornerstone of the global fight against HIV/AIDS through programs like PEPFAR, the President's Emergency Plan for AIDS Relief, contributing billions of dollars annually to prevention, treatment, and education in over 50 countries, especially in Africa and Southeast Asia. Yet, in a sudden policy shift, this vital financial lifeline is now being significantly reduced, leaving millions at risk and many questioning what comes next. The U.S. government, citing budget reallocations and domestic priorities, confirmed that the majority of its contributions to international HIV/AIDS programs will be scaled back starting this fiscal year. According to official reports, this means more than $3 billion in annual funding will be either cut or redirected. While some U.S. officials argue that other donor countries and private organizations will step up, global health experts warn that this decision could not have come at a worse time. Despite significant progress, HIV/AIDS remains one of the deadliest infectious diseases, with over 39 million people globally living with HIV, many of whom rely directly on U.S.-funded treatment and prevention programs. Health organizations, including UNAIDS and the World Health Organization, have expressed deep concern. In a joint statement, they described the funding cuts as a potential death sentence for millions. PEPFAR alone has been credited with saving over 25 million lives since its inception in 2003. The reduction of funds is expected to cause immediate disruptions in antiretroviral therapy supply chains, HIV testing services, and prevention education, particularly in vulnerable regions like Sub-Saharan Africa, Southeast Asia, and parts of Latin America. Humanitarian organizations on the ground are reporting that clinics are already experiencing shortages. Some have had to limit HIV testing and reduce the distribution of life-saving antiretroviral drugs. Experts fear that, without sustained funding, new HIV infections could sharply rise, and treatment interruptions could lead to drug-resistant strains of the virus, making the global situation even more dire. Activists and former officials from both U.S. parties have criticized the decision, calling it short-sighted and morally unacceptable. For many, the timing raises eyebrows as the U.S. is simultaneously increasing its defense and military spending. Questions are now being raised about the administration's priorities and whether human lives, particularly in low-income countries, are being overlooked. Meanwhile, communities most at risk, including women, children, and marginalized groups, are bracing for a grim future. Many of them depend entirely on U.S.-backed programs for their survival. Health workers fear that the trust built over decades with these communities could be lost, reversing years of progress in combating HIV stigma and misinformation. In the United States, protests have begun to erupt in major cities, with demonstrators demanding the reinstatement of international AIDS funding. Civil society groups argue that, beyond the moral obligation, the U.S. has a vested interest in maintaining global health security. They warn that allowing HIV to spread unchecked in vulnerable regions could ultimately lead to spillover effects, including global instability and even future pandemics. Internationally, other donor nations such as the United Kingdom, Germany, and Japan are now under pressure to fill the gap left by the U.S., but experts agree that the sheer scale of the American contribution will be nearly impossible to replace in the short term. Some nations have pledged emergency funding, but without a coordinated global response, the situation could spiral into a full-blown health crisis within months. For now, millions of patients, healthcare workers, and advocates await answers. Will the U.S. reverse its decision under mounting pressure? Will the international community step up in time? Or are we on the brink of witnessing the undoing of decades of hard-earned progress in the fight against HIV/AIDS? The world is watching, hoping for a solution, But as of now, uncertainty reigns. What happens next could shape the future of global health for years to come. Dr. Susan Miller, an epidemiologist and former advisor to the U.S. Agency for International Development, USAID, describes the cuts as catastrophic. In a recent interview, she emphasized that the timing, amidst other global health challenges like tuberculosis, malaria, and the lingering effects of COVID-19, could not be worse. "We are risking the reemergence of HIV as a global health emergency," she said, adding that the financial shortfall could also impact research and development of next-generation treatments and vaccines, further stalling scientific progress. Furthermore, humanitarian organizations warn of a potential domino effect. Reduced investment in HIV/AIDS programs may also discourage local governments from prioritizing the issue, especially in regions already battling poverty, political instability, and underfunded health systems. The U.S. has historically been seen as a leader in global health, and its withdrawal could send a chilling signal to other donor nations, leading to further reductions and a vicious cycle of declining resources. Economists argue that the move may ultimately backfire, costing the international community more in the long run. Studies have repeatedly shown that investment in public health is among the most cost-effective strategies for promoting global stability, economic development, and security. Allowing the HIV/AIDS epidemic to grow unchecked could lead to higher healthcare costs, economic downturns in affected regions, and even the potential for HIV to mutate into more aggressive strains, posing new risks to the global population. In Washington, political debates continue. While some lawmakers push for reconsideration, the administration maintains that budgetary constraints necessitate the cuts. Yet, grassroots organizations, faith-based groups, and civil society leaders are rallying across the country, calling for the reinstatement of funding. They argue that America's moral standing and credibility on the global stage are at stake. Beyond the immediate medical consequences, the psychological toll on communities is immense. Many who have lived with HIV for years have done so, with the assurance that treatment will remain available. The loss of this certainty brings fear, despair, and, for some, a return to the days when an HIV diagnosis was considered a death sentence. Mental health experts warn of an impending crisis in mental health support, as communities lose not only physical aid, but also the emotional and psychological safety nets built over decades. As the situation unfolds, health officials worldwide are scrambling to find alternative sources of funding and support. The question remains, will the world respond in time to avert what some are already calling a looming global health catastrophe? Or will history look back at this moment as the turning point where humanity, for the first time in decades, began losing the battle against HIV/AIDS once again? Thank you for watching TVAI.